Hey guys, welcome back. As promised, today we're talking about SOAP notes regarding osteoporosis and osteopenia, as we have covered that this week. For this month, every Thursday, I am going over a SOAP note on whatever content we have covered for the week to tie it together so you can see how to document based on the findings that we have, and then how we apply that study process that I like to discuss with you of assessment, diagnosis, evaluation, and treatment. Okay. All right. So for those of you who are returning, welcome back, you guys. And for those of you who are new to me, I am Dr. Brittany Weinstock, family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I do this to provide tips and tricks to help you guys to be successful on boards, but as well as in practice. Okay. So this is not utilized for treatment solely, but to guide you to the success of your board preparation and practice. So let's get into it. All right. So first, subjective. That's, again, SOAP notes. SOAP is an acronym, right? So the S in SOAP is for subjective. As I told you in the last video on SOAP notes, when we say subjective, that's what the patient is stating. That's their chief complaint. What are they talking about? So one of the practice questions that we did this week, it spoke of, let me go over it. So it's a nurse practitioner is reviewing the patient's DEXA scan results with a T-score of negative 2.2. And then, based on these results, how should the nurse practitioner diagnose? So again, it's just a question format, but I use that as a foundation to kind of walk you through the SOAP note. So we're saying subjective. What is their chief complaint? So here we're going to say they had to come in complaining of something, or they may have had risk factors that led us to proceed with evaluating for osteoporosis or osteopenia to warrant that DEXA scan, right? So subjective could have been, let's remind you, like with osteopenia, they may be asymptomatic. So they may have just had risk factors. They may have been over the age of 35, female, smoker, etc. Or they could have presented complaining of lower back pain, weakness, etc. Right? Different things, but that would be the subjective findings, that chief complaint. Or if it's just a general follow up, you're asking them, are there any concerns you want to discuss with me today? Okay. So that's your subjective. Objective. That's what you observe. So on our exam, what are we seeing? The DEXA scan results. That would go here. This is the thing. Like, how is this patient presenting? We are doing our full exam and placing it here. All right. So that T score of negative 2.2, because this is helping us to formulate everything we need to come up with our diagnosis, right? Now, assessment. Based off of everything we assessed, I always say this is like our summary. We tie it all together right here, right? So what is that diagnosis? What are we tying together based off of what the patient is stating is going on? What have we observed and conducted on exams and received those results? So in this state, as we tied it together, we're looking at this DEXA scan results. So we're going to start thinking differentials versus osteoporosis, osteopenia, right? But here we're going with osteopenia because their T score from the DEXA scan is a negative 2.2. Remembering that those osteopenia test results, and go check out that video from yesterday with the Working Out Wednesday where we do the practice question, as well as the Tuesday's topic and tips where I really get into what osteoporosis is versus osteopenia, those T scores, treatment options, etc. But remembering that the T score for osteopenia is anywhere from that -1 to that -2.4, and then your osteoporosis is -2.5 or less. Okay. So here in our assessment category where we would be documenting, we would put osteopenia, DEXA scan results -2.2, patient is asymptomatic, and then we would move on to our plan, the planning section, right? So here in plan is how do we plan to treat it? What is our next steps? What is the plan here, right? So with osteopenia, that's like that pre-stage. They have that abnormal result, that test result, but it's not as severe as osteoporosis, right? So what do we do with this population? We start to do those lifestyle modifications, right? So in our plan, under that assessment and plan area, again, assessment, we would have that osteopenia. We would put the DEXA scan results, even though that goes under the objective phase where the result was what you have, the findings. But I like to tie it together also in my assessment. So that's why we've diagnosed them with the osteopenia. But in the plan section stating, hey, educating the patient on a balanced diet to make sure they're getting all their vitamins and minerals. We will continue to follow to see if they may need supplementation from vitamins. We want them to, tobacco cessation, like providing smoking education for stopping of the smoking, alcohol, reducing that intake. These are all things that you will put in there. Promoting weight bearing exercises to help with these things. Like we would just put all of those plans and then have the patient follow back up in, if you want to say, 3 months, and see how they're doing, continuing to monitor this, making sure that we're following to see if there's any progression to osteoporosis. Like all of this is the things that go into planning. So I just wanted to go through this so you can start to gauge your mind in the fashion of soap notes, because I tell you to do it all as you're going through, because we're practicing this way, right? To be successful on boards as well as in practice. So we go through all of those steps. But with all of that, I always like you to study in the fashion of assessment, diagnosis, evaluation, and treatment. And if you look at any of my videos, you take any of my courses, do any of my one-on-one sessions, I run this in the ground. So you are very familiar with this if you have listened to anything else that I have taught. But this is what they're testing you on. This is how you practice. This is how we document. So you need to think about it that way, right? So with that assessment, that's those signs and symptoms and how they present. That's that subjective stuff, the subjective and objective. That's all in that finding, right? Coming up with those differential diagnoses. So that's the next step, right? So here, like in this scenario, it's that osteopenia. And then how we evaluate where they are with it. And then your treatment. And we talked about all of our treatment and planning. So you see that it sounds like this is an acronym. This is what they're testing on. And it can all be so overwhelming. But when you slow it down, and take a moment, and I try to put it and break it down into small chunks so you can see it from this way, that is not as overwhelming as it looks, because it's all basically bringing you back to the same thing. It's all connected. You just have to break it down into smaller chunks so that you can retain it and apply it successfully. So I hope that this is helpful to you guys with tying things together. I know these are brief videos because I don't want to overload you, but I want you to be able to grasp the content, tie it together. And as you're going through school, as you're preparing for boards, or as you're newly working through practice, I want you to be able to utilize these resources and navigate through it successfully and with ease. So hopefully this is helping you guys. Let me know in the comments. Let me know if you want me to go over anything additional, and let me know if you have any questions, and I'm happy to help you guys. But as always, thank you for watching. Please like, comment, and subscribe, and share with a colleague, friend, or whomever you may think that may find this helpful as well. But be sure to meet me back here, you guys. All right. Bye, y'all.